working folk don't have a chance unless we
organise. Which side are you on? Which side are you on? Which side are you on?
Tell me
Which side are you on?
The next speaker is Peter Buckney. Peter belongs to the Blue Mountains Nurses, is a member of Nurses and Midwives Association and belongs to the Blue Mountains Union Council, and he's going to talk on health and Medicare.
Good evening all. I work up at Katoomba Hospital. I'm a registered nurse up there in the rehab ward. I don't know where to quite to start. To follow directly on from Tony, we're going to suffer 57 billion of cuts over the next decade or so as well. And that can fund company tax rate cut, can't it? That'll be absolutely brilliant. Now, we're all here tonight. Thank you for the welcome, Auntie Val. Thank you for showing up. Let's get straight down to it. Unfortunately, mine will be a bit big picture, unfortunately, rather than small picture. There's already been a speaker tonight who's told me a horrible story about her experience down at the PM Hospital. They want to squeeze the population roughly of Tasmania into Western Sydney. I haven't heard of one extra hospital bed to be built. If the whole population of Tasmania to be built, to be squeezed into Western Sydney. Anyway, back to Medicare. It's free. We pay taxes, we pay Medicare levy. If I trip over and break my arm on the way out of here, I can go to hospital and get free treatment. I'm not slugged with a bill, I don't lose sleep at night with a bill. So we've got an election on, we all know that. We're about halfway through the campaign. A lot of announcements have already been made. A lot more. I think the big guns for Medicare for Labor will be closer to election day. So we'll have to see what's going to happen. Apparently some deferments have been made on co-payments. Not scrapping, but deferments. There's been talk of budget black holes. We've had Bill Shorten talk about Turnbull's attempts to raise the GST, to get the states to raise their own income via income taxes, and it's all been ruled out. So as Shorten actually says, well, what's going to happen? So we say, well, all sorts of promises are being made and all that, but I think we'll hear a lot more promises. But what we're going to always keep in the back of our mind is what a previous Prime Minister said about promises. There's core and non-core promises. And when it comes to Medicare, they want the individual to pay. They are not committed, the Liberals are not committed to Medicare. So I would actually say, be vigilant and question everything with the election coming up. Okay. For those who probably know, Medicare, brought in by the Labor government back in '74, a double dissolution election for it. I haven't heard the Building Commission mentioned once in this election campaign, and that's the whole trigger for it. The Liberals hate it, let's face it, they hate Medicare. They hate the idea that the collective can pay for the collective good. They want you and you and you to pay for your own health care. And if you can't, tough. They'll take the hine. It was attempted to dismantle, we know that, Hawke and Keating, basically resurrected it. 80s, 90s, old world terminology, macroeconomic reform, and we've had uphill battles against Labor and Liberal governments since then, state and federal. There is one thing though, even John Howard basically gave up on a tax on Medicare, overt tax on Medicare, because he realised that the electoral will of the people, we support Medicare. He basically gave up on it. A couple of budget numbers, or big picture numbers. We spend about 8.5% of GDP on Medicare. The land of the free, which I'll get onto in a minute, spends 16.4% for worse outcomes. Worse outcomes. The OECD average is about 9.4%. We actually believe that Medicare funding isn't in crisis, although we do have our battles on a state level. It's state-run, federally, a lot of federal money, a lot of state money. We do have our battles in the state. State finances from the federal government, about 25% now, should drop to about 12% if they get their way by 2050, so a couple of generation and a half away. How is this difference going to be funded, or that may be the question, as I've alluded to, who will fund this difference? Which gets to my mind a list of horror stories. This is from the land of the free again. The figures are roughly 2 years old. A normal delivery, normal vaginal delivery for a baby. Come on, is there any option in questions? $40,000. Got your insurance? Can you afford it? Your 15-year-old breaks his leg, scoring a try. $4.5 grand. Broken arm for a 25, 40-year-old, $7.5 grand. We're all working to 70. Hernia repair, 106 grand. Breast cancer treatments, 124. You don't miss out. Prostate treatments, 104,000. If you're really unlucky enough to need a liver transplant, 1.5 million. It's estimated that 123 people die each day in the US just because they can't afford their health care. Health and related expenses in the US is a leading cause of household debt and indeed a cause of household bankruptcy in the US. Bankruptcy. Bankruptcy.
Minute to go, Pete.
Minute to go? Okay. In Australia, the cuts will continue. Going back to Howard's sort of comments, it'll be a death by 1,000 cuts. They'll cut a co-payment here. They'll privatise out there. They'll make it a bit hard, another burning hoop to jump through. The push is to privatise, coerce or force us into private coverage. On a state level, which runs it, it'll be the private-public partnerships which will be the preference. No doubt they'll throw up some success stories. There's also the Port Macquarie horror story from 20 odd years ago, which took a decade basically to get back into the state system and to pay their bills off. There's also another beauty. We give the private health insurance companies $5 billion a year to subsidise their rebates. $5 billion a year. Now, if it's supposed to relieve the pressure on the public system, which is bursting at the seams now, it's not working. We're at 100% capacity. Every bed is full. The throwaway line is the mattress doesn't cool down and someone's in it when someone gets discharged. So $5 billion a year, I think, keep that $57 billion in mind, but $5 billion a year would go a great way to helping states and territories fund their services. So again, we must defend what we've got. Medicare is universal insurance for everyone. And it's not just A&E or surgery or maternity, all the other sexy areas that you see on documentaries and TV shows. The big one is primary care. Primary care, especially with an ageing population, they've been through the acute ringer, they know their symptoms, they go to the GP or community health centre, maybe need a hospitalisation with the aim of returning home. Okay, it's not all, we're moving into an ageing population, it's actually a biggie. I don't know if enough's been done. My favourite war story is 20 years ago when I was at uni. We talked about ageing population, yada yada, institutes and whatnot, and they closed hospitals. They closed hospitals. Well, people still need to go to hospital. Aboriginal health, it's a big one. Federal state crossover. Rural health, the tyranny of distance in rural health, it's a huge one.
5 minutes, Pete.
5 minutes. Psychiatry. Now, hopefully others will talk about the stresses of the cutthroat economy that certain people would like to have us in. But when depression turns into drug and alcohol problems, and we all know about ice epidemics, unemployment, health issues, psychiatry is a huge run as long as the actual medical problems that go along with all that. So 2016, we've got a choice at this moment. We've always got to keep Labor. We've always got to push Labor. We know that. We've had our fights with Labor. But we've got an open for business government. State and federal level, they call themselves open for business. That should send a shudder down everyone's spine. I reckon when Smiling Mal is here with Cuddly Mike, we should just call them the neoliberal Leyland brothers. They're tripping around the countryside, privatising, deregulating. They don't give a stuff about us. They just want us to pay. So we can go with that lot, or we can go Labor or Greens, or whichever you think's more progressive, and we say, put the Liberals last and kick these bastards out. Thank you very much.